Okay, my friend.
Okay.
Welcome once again. So, thank you for coming. You come to our country for this our new technique,
Yes.
different technique. You recognize this technique. Can you tell me how did you recognize your disease and our technique?
I am aware of my disease since 10 years ago.
Yeah.
After I felt some pain after a fight, I'm using
Yeah.
the leg box.
Yes.
And I came to a neurologist. He say I have a
You have left testis pain.
Left testis.
10 years before after kickboxing.
kickboxing. I have pain, and sometime after I doing a heavy squat like 200 kilo,
Yeah.
220 kilo squats.
Yeah.
I feel pain, and I came to an hospital. They say I have varicose. They offered me the first technique. I refused. I say
They offered you operation 10
Yes.
years before.
Upper ligation.
Yeah, okay. 10 years before we were changed it, converted it to
They offered me
microsurgery actually.
after in 2016. I make a check. He says they told me it was the dilatation of the vein was very high.
Yeah.
They offered me also make a glue and a cord. I say no.
Yes, embolization or sclerotherapy.
Sclerotherapy, yes. They coming from the
this jugular vein, and
I say no. But after the time, I get worse even since December.
Yes, this so 6 months.
Yes, I cannot walk much. I cannot run. If someone take me a punch here, it's pain. Lifting every day, so sit.
So how old are you now?
35.
35, and you do a lot of sports for this
Yes.
age. It is nice. You are single.
Yes.
You are not married yet, and you had some concerns about your sperm count. And when we do sperm count here, it was fantastic.
Yes.
What was the problem? Why did they find a low sperm count over there?
Yes, I am making 2 laboratories, and they say I have azoospermia.
Yes.
The second one say is not really azoospermia. It's like count decrease. But here you say it was okay.
Yeah, when I palpate when I examination, I said these tests are good enough, big enough, and we made the test again, and like 80 million,
Yes.
yeah. So sometimes mistakes can be made. Unfortunately, we don't want them to, but they happen. So you understand that I am taking out the veins,
Yes.
right?
This is for me logical, because letting the varicose vein inside, because I have many friends that have varicose on the hand, on the arms, on the
Legs.
They remove it.
Yes, they remove.
It's the same principle. You just remove it. You don't wait it be clogged by itself.
Yes, really, it was very dramatic for me when I first noticed with my Doppler. After the procedure, the veins are still there and they are swollen. I was shocked and I thought, what can I do? This is a real, very difficult to wait for them to disappear, because no urologist used Doppler. I use it. And when I look, I see now after the procedure, I looked your veins and we see there is only small veins like 2 millimeters. But in a normal varicocele operation previously, when I look, I see 5 millimeters, 6 millimeters. Patient shocks. And they said to me, hey doctor, what's going on? I said, okay, they will disappear, but sometimes they don't disappear. And the patients see by his eye, it is over there. So vascular surgeons offered me to do like this. And actually one of my patients offered, hey doctor, why don't you take them out completely?
When I make the search on internet, you came out the first time. Yeah. I see, Turkish, I don't want to go there. I found in Europe, in France, in Italy, but when I read the patient's feedback, it say pain. Many of them say they regret to have done this procedure. So I found one American that say remove.
Yes.
And another Turkey and you.
Yeah.
And I start to look at the procedure, say it makes sense.
Yes, the Turkish one is actually my friend. We are improving this procedure together, and I think everybody will convert their procedure to this kind of surgery soon, because it's not difficult, it's easier, and the results are fast, easy. And how do you feel after the procedure? Do you feel the difference?
I feel the difference. Only thing that makes make me square. Sometimes because of inflammation, but
Yes.
after some days it's going back slowly.
Yeah.
But this loud pain, this heat, no.
Heat has gone.
Heat has gone.
And how do you define the pain? It's a different kind of pain.
There is a pain that I feel that you move at something inside,
Yeah.
but the pain itself of that I had before when we use it to talk on WhatsApp is not there.
Yeah, it's not present anymore. There's the pain of the operation. The healing is a little more difficult with this procedure because we take out the testes, we take all the veins, we rip them from the testicle. So sometimes there is too much edema. Sometimes there is nothing, but sometimes there is a big edema, and it may lengthen the healing period. But it's not important, 1 week or 2 weeks at most. And when the edema disappears, the testis is very nice and without these old veins. That's just the operation pain, but the old pain has gone.
Pain after operation was really good. I worked the same day.
Yes.
It was good. But I also asked with the one that was following me before about surgery.
Yeah.
He said he listened about it, but it's too much risky because you can have hydrocele or shock the testes.
No, it's not. Hydrocele never happens, and shock testis, no. And sometimes people feel a difference in their sexual activities before the operation with these large veins. Did you ever feel such things?
No.
Okay, sexual activity was nice for you.
It was good, but now I feel like my libido is a little bit high.
Yeah, sometimes after the procedure, when we take out the veins, there is more blood inside the penis, and you can have more full erections. But it's very early now. Did you ever experience such a thing, such a feeling after the procedure?
Yes, when I woke up in the cell.
Yeah. When you wake up, there was erection. It happens frequently. So we don't have any proof about it. We don't advise for this erectile dysfunction, this procedure, but it happens very frequently. So is it difficult to come to Turkey for such a procedure? What do you think about the hotels, living fees?
It's easy. It's easy. Book the hotel on booking, take the ticket and come. For the hotel you have many choices. I chose the one here.
Yes. Can I ask you, what's the cost of this procedure? For me, we say about 2,000 euros around it. And the hotels, coming, going, plane, everything.
Everything like 5,000.
Yeah, so 2,000 for the procedure, but 3,000. So it can be, your hotel is a health hotel next to my office. It's very close. I recommend, but it is like 80 euros, I think. Is it right?
No, 121 euros.
Really? I have to talk to them again. So they sometimes increase the number.
And personally, the eating?
Not good. You don't like. Okay. So this recommendation is important. I always trust and want my patients' feedbacks. Okay, so there are cheaper hotels. One of my patients said he find a hotel for 45 euros.
Yes, I know.
And he says, okay, it's not very comfortable, but sometimes people come in a very shortage of money, and they have to consider the living. I think it can be less, pull back to 4,000 euros totally.
Yes, it depends on someone. Each one has each one has his pockets. It depends on someone. For me, this is okay.
Yeah.
And personally, is less than what they asked me in European country because I don't have insurance.
Yes.
This is 5,000. It's quite the half price they asked me to do the surgery.
Yeah. In Europe, maybe 10,000 for the surgery or for all of them?
No. If you do the exam, echo Doppler, spermogram, blood analysis, it would go quite 1,200 euros just for analysis.
10,000.
Just for analysis, 1,200.
Okay.
If you make the surgery, everything, 10,000, 12,000 easily.
Yes, so it is all of the cost, everything like half price in Turkey. Turkey is nowadays have very too much advantage about the costs because of the money things.
It's
I don't
my
understand.
second time in Istanbul.
Yeah.
My second time.
So thank you for coming to us.
you.
It's really honor to have here an Italian guy with foreign country. Thank you very much for choosing us.
I hope some people that have pain with varicocele can come here and find the relief. Really.
Thank you very much. Thank you for coming.